Altura and Avaya's CPaaS Enablement WebEx. We wanted to welcome everyone. This conversation is in part due to our partner Avaya building a new pre-built application for CPaaS called ACNS Chat. And our goal was to talk to you a little bit more about CPaaS as a whole and also hone in on the value of the pre-built applications and how important it is to understand that these are available and what the advantage is. So for healthcare, one of the big verticals that Altura serves, and we've had customers like major health systems as well as regional health systems for many years, 15, 20 years plus, they depend on integrating the communication between their patients, their collection area, their scheduling area, and even internally with their care teams. And one of the things that we've learned a lot over the last year or so is that with CPaaS, it makes it a lot easier for all these different areas within healthcare to communicate better and also to be able to offer texting on any voice line to their actual patients and customers. So thinking about healthcare and all of the folks that use the phone to communicate and the patient experience, how important would it be for your organization to be able to offer text or chat on any voice line? So to do a deeper dive into this and explain it better, what I wanted to do is I wanted to paint a picture for you. Take a look at all of the areas on your website that have a toll-free number and all of the areas within your organization that have direct dial numbers, DIDs we call them, direct inward dialing numbers. Imagine people using their cell phone calling you, and when they dial your number, get a prompt that says, instead of completing a voice call, would you like to initiate a text or chat session with your healthcare provider? That's what happens. And if the person calling you on their cell phone would rather enter into a chat or text session instead of a voice call, they hit a prompt on their phone from the message that they get that asks them if they want to be enabled. They click on it, yes, and basically they're opting in to do texting and to chat with you and members of your group. So the toll-free number or the direct inward dialing number, whoever it's assigned to, those folks would be put into a queue from the hospital, your employees, and they would be members of this queue within ACNS Chat. So anyone in that group would receive that text message, or it would go to a specific individual, and then basically the same things that you would do in a conversation can be programmed in chat responses or can be customized with your folks answering any of the patient or member questions or customers' questions or even other employees. So anybody that's responding would be responding with personal messages or with pre-formatted chat messages. Think of it this way. You have an IVR system, integrated voice response system for your phone calls. Now you have the same ability using text and chat and offering that to people that are your customers, employees, or members of a group to better communicate with you. So you're communicating with your customers the way they want to be communicated with. And this is totally HIPAA compliant, and we can do a better overview of specifics for hospitals. What I first wanted to do is talk more about why pre-built applications within CPaaS is so important, and why it might be a good way for your organization to enter and learn more about how CPaaS can help you. And when we talk about CPaaS enablement using a pre-built application like the ACNS chat app from Avaya, it will save you thousands and thousands of dollars versus trying to build your own application. So we wanted to give you a better idea of how that will work and offer this to you. And what I wanted to do first is to play a brief video that gives you an overview of CPaaS and then does a better drill down about how ACNS chat would actually work.
Introducing our newest communication module, ACNS Chat. Offered as a standalone solution or as part of a more comprehensive system, ACNS Chat is a cloud-based SMS and web communication tool back to contact center agents. ACNS Chat efficiently connects users to an agent via SMS with no app or user account required. Agents access the platform online by user group and share dedicated numbers for flexible tenancy options, like specific locations, a new product line, or business department. With the support of CPaaS APIs, a single number can receive hundreds of messages per second to multiple agents across locations. The solution is hosted geo-redundantly for reliability and keeps a central log of all correspondence without the need for transcribing messages from personal phones. Contacts are redirected to other representatives when they log off. ACNS Chat allows for WebRTC video feed and MMS options, SMS, picture, video, and voice note.
I authorized my student to go on the field trip.
Insurance claims with a real-time video feed of car or home damage will authenticate and expedite the reporting process. Beyond two-way messaging, agents have the ability to request location through a texted link, allowing distribution centers to receive their driver's location alongside other relevant material, like damage to a shipment upon delivery. For escalation or follow-up, a transcript of the communication can be forwarded to the appropriate party, like the progress of a healing suture to an overseeing physician. ACNS Chat is subscription-based software as a service. Together with our other communications modules, mass notification with response and location request, AutoForm for inbound data collection, Hotline with end-user configurable extensions, and ACNS Chat for efficiency and security.
Now, what's important about the ACNS Chat application is that as a pre-built application, if you were interested in enabling text messages on any of your voice lines, this would be a great way to start and learn how chat and text can be routed efficiently within your organization, how you can create text messages that are templated in order to get information from the folks that are wanting to communicate with you. And we can assist you with building that out. So all you would need to do would be to determine who are the actual folks within your teams that you would want to be members of the ACNS Chat, and they would have to be set up by whoever your administrator is and given permissions. Once you have that subscribed to, it can be deployed and implemented. How much does it cost? Setting up the technical requirements up front, which Avaya will help with, is easy. That's a small setup charge. I believe it's about $1,000 plus for the ACNS Chat app that's pre-built. The subscription-based pricing is about a penny or two per minute based on the number of minutes you would be, or number of messages, pardon me, not minutes, you would be using. So we would have to look at the phone bill, how much you actually spend in terms of time talking, and then come up with an estimate of what percentage of that would be maybe texting, and how we could make the communication more efficient, collect the information you need to have better outcomes and shorter conversations with folks. Those are some of the things that we'd want to talk more about and come up with an action plan for you. We believe, Altura believes, that this is a very cost-effective solution, and it is a good way for your organization to be able to test whether or not the CPaaS technologies are a good fit for your organization going forward. Now, something really important that you need to know about is every healthcare entity has different types of communication infrastructure, such as telephony, data networks, and we respect that. The unique part of this program is that it is cloud enabled and it will interface with most any technology. So most organizations, when they start talking to you about CPaaS, are talking about all the customization that you can do and all of the build out and what have you, which implies that you're going to flip the bill for actually developing and implementing, and kind of like you're on your own to do this. Altura's approach is much different. we think it's better to get experience with pre-built applications that are already built so that you can test the best uses within your organization, because every organization is different. So what we'd like to do is talk more about what is actually involved in the ACNS chat demo, which we're going to do in a few minutes. So I wanted to give you a few minutes to collect your questions and any thoughts, and wanted to put together a question and answer session for the end of this video. So we'll be back in 1 minute to review your questions. So we hope you've had a chance to think about some questions that would be relevant to your organization. Before we get into some of the Q&A, what I wanted to do is talk through a couple scenarios, because every health system is different. And health systems range from rural to mid-market, smaller communities, and of course our larger communities where we have regional hospitals and in a group, an actual healthcare system. So for rural healthcare entities, there are so many challenges because of limited technology that might be available. Bandwidth with the internet may be an issue, but also resources and who's available. And folks in rural healthcare environments really are challenged more because they need to know when their folks are available. They need to know that there is coverage, and using the technologies wisely can help you even more. So take a health system that maybe is a hospital with maybe 25 or 30 beds that has care clinics throughout the region, and they have both affiliated doctors and clinics and also in-network and hospital-owned clinics. You're going to be communicating within your network a lot. So using CPaaS can be done within your employer group or even within your provider group, and that's important to know. Plus, thinking about how many of your folks that are calling your numbers are using a mobile phone. That's important. So again, taking and maybe surveying the number of folks that are actually using mobile devices, I would challenge anyone to say that it's well over 50% and could be as high as 80% if folks are calling you expecting to use the phone system to either schedule an appointment, follow up on care plan, talk to a physician, or even pay a bill. So again, how can we better serve those folks that are calling and not use your resources on the phone and use more self-service options and incorporate that into chat? It's easier to do with chat and with texting. And that's part of what we wanted to talk more about and get you thinking about. So for the larger health systems that have the clinics, that have the laboratories, you have a lot more intensive need and demand, because folks are less patient, want results of tests, want to know what the next step is. Maybe they want to book appointments seamlessly. So you're using technology and integrating that a lot more quickly, and it needs to be a lot more robust. You're going to have a lot more traffic, I would think. But again, having the capability to manage and use what is available that best suits your needs is what we want to talk about. Okay. What I'd like to do now is show you a little bit more about the pre-built CPaaS application using ACNS and the ACNS application. So when we talk about ACNS application, this is in the cloud, and you actually will receive a login and password, and you will need to dedicate an administrator to set up your ACNS chat application within CPaaS. What that means is they will assign different users. A user is somebody that would be able to log in a specific group, like for example, in maybe your admitting department, or maybe within your care teams, and they have certain responsibilities. So within that group, what you can do is, as you're setting up via ACNS template, you can also create messages that help introduce your team, qualify who's actually texting you so that you're, of course, HIPAA compliant, and then get them to opt into that group and to your organization. So let's take a look at our ACNS chat application a little bit more detail.
This is a quick demo on our two-way SMS web app. So you go to the Avaya Cloud Notification Portal, you log in. One of the modules is chat, and this is basically SMS and MMS chat. So you'll see here, you pick the landline that you want to manage SMSs for. So this could be a toll-free or a DID. Multiple people can log in and manage this. The beauty of this is that basically CPaaS will SMS enable any landline, and then I can go in here and not only receive, you see here, I'm receiving, I can respond. If you use this for a demo, you get people to send messages in, you can send messages out. You can send multimedia. This would allow you to send basically rich files like a video or a picture right to their device. And you can even request location. So if you do this, it asks them to give permission to send their location. And if they give you permission, it'll show up on this map. So you can imagine the use cases is beyond just two-way SMS, but it becomes a rich communication center around texting, both SMS and MMS. This is available today. It's a written app. Now, to embed this into other applications, that's where you get into customization and APS work.
So when we talk about APS work, we're talking about Avaya Professional Services, and also with Altura's overview and support. Part of what we want to do when you actually set up your ACNS account for CPaaS, we want to engage with you and figure out what potential additional items you want to actually test and use. So beyond the text environment, for text messaging to handle maybe patient follow-ups or what have you, maybe if you're scheduling testing or you want to provide results to folks that have opted in through your Avaya CPaaS ACNS chat app, you could also send test results to them or provide them with the actual video or imaging, for example. These are all things that can be built into the overall program that are things that we wanted to talk more about with you. So in terms of questions and answers, a couple of the questions that have come up from healthcare organizations, maybe this is one of the questions that you've been thinking about is, okay, let's say I want to test this and I go ahead with wanting to set it up. How long does it take to actually get onboarded where we can actually offer it? In other words, what would my start date be? Typically, it's about 30 days to get you up and running. How do I pay for it? It's a subscription-based service. So there is a startup cost to implement it. That's done through Avaya Professional Services. It's usually between $1,000 and $2,000 upfront, and then you have an account. Then that account you can actually decide to prepay for X number of messages per month or year or what have you. And over the course of a couple months, you're going to see what the average amount of messages are going to be that you're going to be using, and then gauge ways where you can benefit by the better management of your teams that are using this, and then maybe offer it to more folks across the board. You can offer the Avaya ACNS chat app to anyone that has a direct line, a DID number within your organization, and they would be able to text from that and opt people in as well. So maybe that would be a care team, maybe that would be a nurse triage, that could be somebody in your testing area. It could be verification, when you're doing appointment scheduling, and verification could be anything. So these are all great tools. So one of the other questions that came up is, let's say we're encouraged and we really like the capabilities that have been shown to us and that we're using over a period of like 5 or 6 months. What would be the next step? What are the other things that we could look at in terms of CPaaS? Well, good question. And the answer really is, based on your needs, we will work with you to identify other areas that are concerned or on your wish list. For example, one of the things that's coming up with a lot of organizations is, hey, we want to have the ability to do on-demand testing and have this completely managed in an automated way. We can help you do that through IVR and also through CPaaS. Another question that came up is contact tracing is a huge need. There is funding available from the government, and we want to develop a contact tracing solution and system for our organization. With Avaya CPaaS, we have ways that we can help you with that. So these are a few of the things that are available in terms of Avaya CPaaS and available with the pre-built app. And what we want to do now is take your questions and then have a follow-up conversation and schedule an actual call with a CPaaS expert so we can go one-on-one into any greater details and show you more to make sure that this is a good fit for your organization.